When is the best time to take antihypertensive medication? Does the gut microbiome affect cancer treatment? What should patients know about chronic migraine? We'll cover this and much more on this episode of the JAMA Editor's Summary. Hello, and welcome to our listeners around the world. Today is Friday, May 16th, 2025. I'm JAMA Deputy Editor Dr. Linda Brubaker, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief for JAMA and the JAMA Network. Today I'm joined by JAMA Deputy Editor Dr. Preeti Malani. Hi, Preeti. Let's get started.
Hi, Linda. Patients and clinicians have lots of ideas about the best time to take blood pressure medications. Findings from prior clinical trials have not been consistent. Earlier this week, JAMA published the BEDMED randomized clinical trial by Dr. Garrison and colleagues. The investigators compared antihypertensive medication timing, bedtime versus morning, for adults with hypertension being seen in primary care. The authors conclude that although bedtime administration was safe, it did not reduce cardiovascular risk compared with morning administration.
In an accompanying editorial, Dr. Taylor explains how the BEDMED trial strengthens evidence about the timing of antihypertensive medication. Bedtime dosing may not be better than morning dosing. There's an associated trial, the BEDMED FRAIL trial, featured in JAMA Network Open that focuses on older adults.
There's also a randomized clinical trial by Dr. Lee and colleagues that evaluated Amiloride as an alternative to Spironolactone for resistant hypertension. The investigators conclude that Amiloride was non-inferior to Spironolactone for lowering home systolic blood pressure among trial participants, suggesting that it could be an effective alternative for treatment of resistant hypertension.
And in their editorial, Dr. Brook and colleagues discuss how the need for additional treatments for resistant hypertension makes this study timely and important. Preeti, let's hear about the research letters in JAMA this week. These are being presented at the 2025 Society of General Internal Medicine annual meeting.
Okay. Michael Liu and colleagues authored a JAMA research letter evaluating changes in physical and mental health after the end of the Supplemental Nutrition Assistance Program, or SNAP, emergency allotments. It was concerning to see the resulting increases in poor physical health days and food insecurity.
Yes, a very concerning and timely report. Turning to insurance coverage concerns, Dr. Tsai and colleagues investigated the effect of the Inflation Reduction Act, which introduced an annual out-of-pocket spending limit and increased coverage for high drug costs for patients with Medicare Part D in 2025. This cross-sectional analysis found that more insurers covering Part D beneficiaries left the marketplace in 2023 and 2024, just before the 2025 changes, more than in previous years.
Dr. Dusetsina and colleagues also evaluated aspects of the Inflation Reduction Act. They examined trends in launch prices and price increases for self-administered anti-cancer drugs in relation to the Inflation Reduction Act, which limits price increases after market entry. They report that there was not a disproportionate increase around the Inflation Reduction Act introduction, although launch prices continued to increase during the study period.
Dr. Beckman and colleagues authored a research letter about dental and vision care in veterans. There is increasing co-enrollment of Medicare Advantage insurance with VA benefits in the veteran population. While the Medicare Advantage plans cover supplemental dental and vision care that is not typically covered by VA or traditional Medicare benefits, the authors found similar usage and spending in dental and vision services in veterans with Medicare Advantage and traditional Medicare.
JAMA published a viewpoint this week by Dr. Rosa and colleagues. They write about the role of affirming language and provide clinicians with tools to support transgender patients in the setting of evolving anti-trans policies. Linda, there's some informative clinical content in JAMA this week. Dr. Fernandez and colleagues contributed a fascinating JAMA translational science review about the microbiome and cancer. They discussed the role that gut microbes may play in cancer development, progression, and response to treatment. JAMA Deputy Editor Dr. Mary McDermott discussed this evolving area of health with co-author Dr. Jennifer Borgo on the JAMA Clinical Reviews podcast. Let's listen to a clip as Dr. Wargo discusses mechanisms for attaining a more diverse microbiome.
But what can we do to positively impact the microbiome? And so there's a couple of things that you can do to favorably impact the microbiome. One is in patients with cancer who actually have what we would consider to be an unfavorable microbiome, who have been treated with a lot of antibiotics and who maybe haven't had a good response to treatment. You can use things like fecal transplant, believe it or not, which they also use for C. diff colitis. And patients with cancer have actually been treated with fecal transplant or a fecal microbiota transplant or FMT. And it's actually been shown to reverse resistance to treatment with immunotherapy. Now, mind you, this is just in clinical trials. This is not approved. Nonetheless, I think really promising strategy. But short of that, I think dietary changes can actually favorably impact the microbiome. And our group actually showed a few years ago that if patients with cancer who were going on to treatment with immunotherapy reported taking a high fiber diet, they actually were much more likely to respond to treatment with immunotherapy.
The U.S. Preventive Services Task Force issued a reaffirmation recommendation statement for syphilis infection screening in pregnancy. This is accompanied by an evidence report by Dr. Asher and colleagues. They present the evidence supporting the need for two-step serologic syphilis testing.
There's more to read about syphilis in JAMA this week. Dr. Dobbs and colleagues wrote an editorial about the increases in maternal syphilis and congenital syphilis. They encourage clinicians to adhere to the screening guidelines for effective syphilis management. And the patient page is also all about syphilis, focusing mostly on congenital syphilis, screening, and syphilis during pregnancy.
Dr. Ulash and colleagues contributed a JAMA clinical challenge about a woman with upper body swelling during dental cleaning. Another patient page wraps up the clinical content this week. It covers diagnosis and treatment of chronic migraine.
Don't forget, you can search for JAMA Medical News or click the link in the show notes to find the latest articles in clinical medicine, biomedical research, public health, and health policy written and researched by our outstanding JAMA Medical News team.
Thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Linda Brubaker. This episode was produced by Daniel Morrow and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.